There we go. All right, there we go. Sorry for the technical delay there. Technology, gotta love it. You know, I'm not, everything's good. Okay, hello and welcome everyone. Everyone can see us and hear us okay out there. Please let us know if it's not coming through and can be heard and everything looks good. I think on my end here, I can see. Let me just do a double check here. Looks good to me. Okay, let's get started. Welcome and thank you all for joining today for our special presentation entitled Spotlight on Lupus Nephritis, an educational symposium sponsored by Aurinia Pharmaceuticals in honor of National Kidney Month. My name is Kelli, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you are unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect, grow, and inspire each other throughout the peaks and the valleys of our lupus journey. And I say our because I live with systemic lupus and multiple lupus overlap conditions since the age of 11. So we believe that every person living with lupus, no matter their background, should be treated with equity, with dignity, and taken seriously. And it is our mission here that patients feel heard, patients feel seen and valued. So today's event will spotlight the unique challenges of people living with lupus nephritis and give two unique vantage points. One from a doctor who treats SLE and lupus nephritis, and one from a living with it. So we hope that the information provided today can be used as a resource that hopefully propels you to have an open and honest conversation with your doctor or doctors regarding your questions and possibly your concerns about lupus nephritis. And by the way, please make sure that you share this live event on your personal Facebook page so that people can get connected to community and support and have access to some incredible information and resources that will be shared today. But before we continue, please allow me to give you a brief disclaimer. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and or opinions of your doctor. If you are experiencing lupus, lupus nephritis, or lupus overlap symptoms, it is important to follow up with your doctor and to seek the treatment that is best for you. Our panelists are qualified professionals, however, they are not liable for their comments since they are not acting as your personal physicians or health advocates. So it is time that we as a patient community delve deeper into this conversation, and I am thrilled to have Danny, Strategic Alliance Manager and Advocacy Representative for Aurinia Pharmaceuticals, here to introduce our first speaker.
Well, thank you, Kelli, and good afternoon. And I'd like to thank you, Kelli, for the opportunity to partner with your group to bring about this important talk about lupus. And so at this time, it is my pleasure to introduce your speaker for today's program, Dr. Laura Geraldino. Dr. Geraldino is an assistant professor and director of lupus clinic at Columbia University. She graduated summa cum laude from Intech University in Dominican Republic. She completed her internal medicine residency at SUNY State in New York and a rheumatology fellowship at Columbia University, where she stayed on as a faculty member. Her areas of clinical and research interest include systemic lupus erythematosus, rheumatoid arthritis, and musculoskeletal ultrasonography. She has been the director of the lupus clinic at CUIMC since 2010 and has been awarded a Rheumatology Scientist Development Award from the Rheumatology Research Foundation and an investigator-initiated Pfizer Award to study cardiovascular disease in lupus patients. And with that, Dr. Geraldina, you may begin.
Thanks so much, Danny, for the kind introduction there. And welcome everybody. This is always an exciting thing for me because this is one of the topics that's very dear to my heart. I've been taking care of lupus patients for now 15 years, and lupus nephritis remains that main manifestation that can really complicate the lives of people with lupus, and it still remains a challenge on how to treat it. So with that, we will take it away with our presentation, confirming everybody can see that. It's looking good there. Very good. So let's talk about lupus. When we're thinking about lupus as a condition, we know it can vary a lot from one person to the next. So we have some patients that have predominantly skin manifestations. Other patients have arthritis with swollen joints or painful joints. Other patients have involvement of their kidneys. And what happens in lupus is that our immune system that's usually there, very active to fight things like infections, cancers, bad things that are foreign to our body, our immune system starts being dysregulated and starts attacking ourselves. And depending on the manifestations we're seeing, is that immune system attacking those parts. So when the lupus affects the kidneys, that's what we call lupus nephritis. And while we might think that that is rare, it actually isn't. So we're talking about 1 out of 2 people living with lupus. So 50% of people living with lupus will have their kidneys involved at some point in the course of their disease. So it's not as rare as we think, and that's why it's important for us to be looking into this and making sure that it could be diagnosed early. So when lupus happens in the kidneys, what we start seeing is that inflammation happens in the organ. So what happens is that the longer the inflammation stays in that organ, then we start seeing damage. So when damage happens, those are things that we cannot fix or reverse with medications at that point. So the kidneys, eventually then will stop functioning as they would normally do. And the kidneys are essential really for our body to function properly. We know that they are there to remove waste from the blood, to manage the balance of fluids that we have. And when those kidneys then get damaged, they are not able to perform those functions. I think I jumped there. And what happens also is that from that problem, from the kidneys not being working accordingly and doing these functions that are essential really to the health of our body, then other organs and other parts of the body can start to have consequences and damage, putting a bigger burden on our heart when it cannot manage the fluids properly, for example. And we can start seeing actually more complications that stem from that damage that occurs. So the goal is to try to prevent the damage from happening so that it doesn't progress to needing things like dialysis or a kidney transplant when things are already irreversible. So who gets affected by lupus nephritis? So it's important to keep some things in mind because, it points towards some patients that are at greater risk. So it's important that we have those aspects into consideration and perhaps be checking more frequently because we know that the race ethnic background does play a role in lupus. So we tend to see that lupus can start younger, it can be more severe, it affects more commonly patients that are Hispanic or Black. So knowing that, we have to be specifically more surveillant when we know we're treating people that are of these racial ethnic backgrounds, because it is more likely for this to occur. And like I said before, it sounds like it might be rare in occurrence, lupus nephritis, but it really isn't. So we're talking about roughly over 100,000 people that are living with lupus nephritis in the United States. So, and importantly, 1 out of 3 people get diagnosed with lupus nephritis at the time of their lupus diagnosis. And that actually makes it way more challenging. And just before starting the program, we were having some conversations behind the scenes about how just today, I saw a patient that this was his first manifestation. So he was having symptoms for some time, but the kidney involvement really was the first thing that the lupus started to attack. And sometimes that makes things get delayed in the diagnosis, unfortunately. And you know, we have to always try to do it as early as possible. So that could certainly have some bad impact in terms of the outcomes. But important to know that it could actually be the very first manifestation of lupus. So, and in general, lupus is more common in women. So we're talking about young women in their reproductive years. That's where we more commonly see that. And for every 10 people with lupus, we have 9 that are women. So even though men are, you know, more rarely affected by lupus, it's important to know that the kidney disease, the severity of the disease, it's worse in men. So something to keep in mind, because often then men, you know, lupus is not a thought that occurs early on when seeing a man. And it's actually very important to do so, because delaying their diagnosis and treatment could have very impactful consequences. And let's talk now about what are those signs of and symptoms that we can pick up on. So it's important to know that they could be quite subtle. So and hence then hard to recognize. You might not be sure what's going on. When we do see some signs and symptoms, the most common thing is that the feet start to swell up. So this comes from how we mentioned, when the kidneys are not working properly, then fluid starts to be retained. It's the fluid balance is not there. So our body starts retaining that fluid, and it starts, you know, from the feet down. So we start seeing, as things worsen, it starts in the feet and coming up to the legs as things progress. But the swelling in the feet and or coming up to the legs is one of the things that could be noticeable. It doesn't always happen. So we have to know that it might not occur, and it still could be lupus nephritis. Because we're retaining fluid, then weight gain is another of the signs that we could identify, especially when it's a very fast change. You know, some people are in the habit of checking their weights regularly, or they just notice this is a big change. But especially when you see that checking the weight from one day to the next is over 2-3 pounds, so that raises suspicion as well. Other symptoms could be increase in the urination, so especially at night. So we see those changes in the patterns of urine, and also the appearance of the urine. So it might be that it looks very frothy or foamy, like bubbles, and that indicates that there's leakage of protein in that urine. So when it looks kind of like when you pour detergent, very foamy, bubbly, frothy urine, that could be one of those signs that this is actually the kidneys leaking protein that they would have otherwise retained. But because they are injured, they're not doing their proper function. And then that's what we see. So when we see that leakage of protein in the urine, that's what we call proteinuria. And this becomes really important because it's the most important thing that we identify to make a diagnosis for lupus nephritis. So it's something that your doctors are looking at every visit, making sure that the kidneys are doing okay. Something that can happen, and sometimes it's just microscopically, so you don't see it, but your doctor tells you there's actually blood in the urine. It's more commonly like that it's just microscopically and you don't visibly see it, but it sometimes could be also just visible to the eye. And when that happens, the blood in the urine is what we call hematuria. And that's another sign that's helpful to make the diagnosis. And overall, because the kidneys are not working well, they're not doing their job properly, we tend to see then abnormalities in electrolytes. So the potassium goes high. There's a decrease in what we call the glomerular filtration rate. That just means how good the kidneys are at filtering. And if they're not good at it, then we see that number just drops. And we see at the same time that then the creatinine increases. So with all of these changes, then on some cases, we start seeing that then high blood pressure ensues. So then somebody that's young and never had a high blood pressure problem suddenly now has a high blood pressure. That's one of the other things that you could notice, or your doctors can notice. And at the end of the day, the way we diagnose lupus nephritis, once we see some of the signs and symptoms that are suggestive of it, is confirming it with a kidney biopsy. So that's usually the trajectory there for signs and symptoms. And thinking about which complications we can see from that. As we said, it's the kidneys are the organ that, that is having inflammation, having injury from the lupus, but that triggers a cascade of problems, because then we're not managing the fluid balance properly in our body. Then the blood pressure increases. That puts a burden on the heart. That can give you consequences also with having cardiovascular complications. And as that inflammation in the kidneys continues to go on, then it stops just being inflammation and it becomes really like scar tissue, which is not functional, is kidneys that don't work. And that's when there's a great progression and it's just complete damage of the kidneys, then that's when we call it, end stage, or it's when patients will need then either dialysis or a kidney transplant, when those kidneys just cannot reverse that condition. And that's kidney failure. So how do we diagnose this? What is that road? How does that look like? So we said, your doctors, once you're diagnosed with lupus, they know they have to be looking at this because it's something that commonly happens. We said in 50% of people living with lupus. So every time you're seeing your rheumatologist, periodically, at least every 3 months, they are looking at what's happening with the urine and looking also at some blood tests. And specifically in that urine, they're looking at the protein. So how much protein are the kidneys leaking that you can measure actually in the urine? And it's commonly your rheumatologist that would be checking on these labs. But it depends, like we said, it could be a nephrologist also, especially if the first symptoms of lupus were the kidney symptoms. So, and for the most part, the labs are usually done at the doctor's office or the lab, but there's some convenient forms these days. But whatever works, it's not a fancy test, a very simple test. We're just checking that urine, checking if it has protein leakage in there. And like I said, it's important to, even if nothing is happening, even if your lupus is very well controlled, it's important to be measuring that, because you might not notice. It might not give you those symptoms of swelling. So commonly then naturally it's the rheumatologist or your nephrologist that would be diagnosing lupus nephritis. And often, especially if there's a lupus center, those two specialties will work together towards that end. So other tests, so I said it's not just the urine. The urine is the most important test we're looking at, specifically to check on that protein in the urine, and also the blood that I said it might not be visible, but we actually check microscopically for it. Also in the blood, we measure how well the kidneys are functioning. And some of the measures there is the creatinine, which I briefly mentioned before, but what that is a product of waste. So we said the kidneys manage the waste in our body. So if they're not working well, that waste goes up, right? And then we see that there's an increase in that measurement, the creatinine. And simultaneously, then we see that the filtration ability of the kidneys goes down. They're not able to filter properly as they would normally do. And then ultimately we get that kidney biopsy. The kidney biopsy is very important. I know you would say, but what happened? We already have the urine and the blood test. But the thing is that lupus can affect the kidneys in different ways. And also, not just the different types of ways in which lupus can affect the kidneys is important to see in the biopsy, but also to see how much inflammation versus damage there is, because that helps us then set up the stage for the treatment. So that's how that biopsy becomes the ultimate way to confirm and plan a good treatment approach. So what is that magic number? What is the number that we're all looking for when we are measuring the protein in the urine? So we want to make sure that there is no more than 0.5 grams. So, and it's important to have an idea of this number because it's something that you can track, especially now that we have EMR, and you can see through the portal how your numbers are looking, seeing is it more than 0.5 grams, because that's really the number at which we start to get concerned, and we have to consider seriously that lupus nephritis could be occurring. So 0.5 is that number that should trigger that workup, getting all the tests, getting the kidney biopsy, and starting that treatment promptly before things worsen and get to that damage that we want to absolutely avoid. In previous slides, when I was mentioning the filtration capacity of the kidney, that's what we call this estimated glomerular filtration rate, or GFR, and that's how good the kidneys are able to do that. So we actually get a measurement in the blood. This is a blood test, and they will tell you if it's less or greater than 60. So that's the number that we want to keep it above. We want it to be able to filter at least greater than 50. And that's something that your doctors will also be looking at periodically, regardless of symptoms. So the kidney biopsy, I cannot emphasize more, but it's really needed to confirm that diagnosis and just to tell us the extent of inflammation, the extent of damage, and then that could help us then plan a proper treatment to manage that specific status of the kidney. And that's our next slide here. So how do we commonly treat lupus nephritis? So we know that we need to control that inflammation as fast as possible. So steroids are still our cornerstone to go to first because they work the fastest. We know that the steroids do have a lot of side effects, and of course we want to try to go down on the dose as fast as we can, but they are the one thing that works 24, 48 hours, starts calming down that inflammation. So we start that immediately as soon as we get that diagnosis of lupus nephritis. And along with that, we start the immunosuppressants because those other medications then help us. They're slower in acting, but eventually they take over and they help us then slow down and slow the dose and get rid of those steroids. So that's a combination that's really important. Another thing we use is blood pressure medication, and that's for two purposes. We know that sometimes the blood pressure just gets high when we have lupus nephritis because of all the consequences we saw, but also because there are blood pressure medications that have protective effects for the kidneys. So even if the blood pressure wasn't high, it's good to get these medications on board to get that extra protection for the kidney. And the antimalarials should not be forgotten because they are really the medications that can help us prevent a subsequent lupus flare, not just for the kidneys in general, but for any kind of flare in lupus, specifically to try to prevent worsening once there's already been a history of an episode of lupus nephritis. So it really helps us with that prevention plan. And in general, it's good for your treatment in lupus, whether there's been nephritis or not. So it's a very helpful drug to always have on board. And keeping in mind that, living with lupus nephritis and with lupus in general is really a lot of different components that we have to take into consideration. It's working with your healthcare provider. So it's a team. It has to be somebody that you have great rapport with because it's a long-term relationship. These doctors are going to be seeing you through ups and downs. So it's really important to have that good team, and taking control of your condition in the sense of like empowering yourself to know as much as you can. So everybody who's listening to this is doing that. It's learning, it's empowering yourself to know more about your condition because nobody knows your body better. It will never be the case. As good as your doctors are, when things are wrong before they do, you start noticing those things. So learning about your condition, should I bring this up? Yes, it might be really important. So that's very important, and also diet and exercise and overall healthy living. And we'll touch upon some of those last points in a couple of slides from now. But it's important to know that the treatment, the follow-up in lupus, it's really this team. It's your healthcare team that can consist of a lot of different providers, and it depends on which are the symptoms that have been affecting you at any given point in time. Usually for lupus nephritis, your closest follow-up will be, of course, besides your rheumatologist, the kidney doctor. But, depending on what's happening, it could also be a dietitian, it could be a cardiologist, a dermatologist. If rashes are an important part, they can do other things, injections to the skin and whatnot. So each specialty can offer a lot of resources. So getting all the help we can from every specialty, it's quite beneficial. So it might seem like, oh, too many doctors, but it's actually like good because, oh, this other doctor can do this extra thing. And having this team of support is really impactful and works very well. So, so how do you work with your healthcare team? Because yes, all these physicians and all these coordinations, it could actually be a bit hard in terms of keeping track of all of these things. So how to be your best self-advocate? You have to, I think write down things, or now that everybody has a cell phone, that's very helpful. Use that calendar, it's hard to have to remember every single thing. So keeping track of the appointments, writing down all your contacts for all your physicians, your symptoms, especially if you're not sure if something's important, you can write it down. Okay, I'll mention that when I go to my appointment so that you don't forget about it. And also just organizing some important results so that you can maybe bring them up for discussion when you go see your rheumatologist or nephrologist. Bringing all your meds. I liked either the list or your actual meds, because sometimes there's confusions in how you're taking things. So it's only helpful to come with everything and making sure that there hasn't been something that, for example, another provider gave you that might interact. It might not be a good combination to take together, and all of those kinds of things. And very important is to, I think, bring a friend, family member, anybody of support that could come to your appointments with you, because it's a lot. And sometimes, having that extra person there reminds us of, but you said you had this that happened, or you did take that medication for a few days. So it's just very helpful, because the more support, anything that could improve our detection or outcomes, we want to bring that on. So, and it was quite concerning, especially during the pandemic, that it was reported that around 50% of people with lupus felt like the access to providers was just not there, that it was affected. Thankfully, we're out of that pandemic, but make sure that you can, exhaust all the pathways to reach to your physicians. Like now that there's been a lot of like telehealth portals, most of the systems have this resources, it's kind of easier to stay connected with the doctor. So make sure that those resources are actually being put to use, because they could come in very handy. And some of those specific tips for the telehealth encounters. Telehealth is still available even as we've come out or coming out of the pandemic. And it could be a helpful way of keeping in touch with your doctor if you would have otherwise not been able to go to your appointment. So, but make sure to use some of these tips to make the best out of that telehealth encounter, because you want to make sure you have good internet connection, because otherwise, it's not going to work well. You want to make sure you write down the questions that you're going to have for the doctors. If you have, for example, at home, things like a blood pressure cuff, we'll check on that, check your temperature so that You can just tell your doctor, these are my vital signs. How do they look? Is that looking okay? Having proper light, wear something where, like, if you want to show a rash that's happening, you could be able to do that. So there's a lot that we can do actually from those telehealth encounters. So make sure that you actually, make the best of it, because it could be quite helpful. And we always want to see labs, but you could always then, after following that encounter, there's virtual, do the labs in a local place, and make sure that then you have your complete assessment for how the lupus is doing. And talking a little bit about beyond medication, because I think it's also really important. So what are we eating? So we know that, especially when the kidneys are being affected, and we said that that could lead to consequences like having a high blood pressure. So we want to make sure we help ourselves also with what we're eating. What's the diet? So the most important thing is to try to avoid then the high sodium, salt, right, content, because that will shoot up the blood pressure even more. So we want to keep that down, avoid processed foods for similar reason. And we want to really favor, eating healthy proteins. So things like white meat, fish, and making our plate have like 1 or 2 cups of vegetables. That's like the bulk of our plate. Then you have your healthy protein and then your healthy fat. Some good things for the healthy fats are the avocados, which are quite delicious too. So that's a simplified picture of what are the things that we want to do. And absolutely, the avoiding the salt becomes the most important when thinking of lupus nephritis and how high blood pressure could be one of those complications. And important too is exercise. And exercise has an impact not only physically, but also for our emotional health, which is very important. If we are not feeling emotionally comfortable and on board with the plan, it all fails. It could be overwhelming, of course, that your doctor starts telling you your kidneys have a problem, you need to be put on all these medications. It just feels like it's too much going on, and we might just shut down and, not be so willing to either participate or just not feeling like doing so because emotionally we're not there. So exercise could serve to help us not only with the physical part, because taking medications like prednisone, for example, weakens our muscles, and we really need to be working out and making sure exercise is part of the treatment, because otherwise we just get deconditioned as we are being treated with all of these medications. But also our mental health. So things like walking, swimming, stretching, yoga, things that are bringing you both of those aspects, physical and emotional, are quite important. And just, emphasizing how you're your own best advocate. You know your body best. You know when things are not going well, before a lab, before your doctors know. So being here, learning about your condition, keep that going, and that can go a long way. So just to end on some tips on how to talk about to your doctor about your kidney condition. So because it's sometimes, it could either be intimidating, or you feel like, what would be appropriate? I don't know if I should be asking this or that, but I think it's very good to be engaged and on top of things and saying, I know last time you saw me, the protein was not doing so great. We started that medication. How is it doing now? And you're 0.5 for proteinuria, right? That we want to get it below that 0.5. So are we there yet? How are my kidneys progressing? Was there a lot of damage in the biopsy? Do we think the measurements are going in the right direction? What can I expect at this point in terms of like complications? Those are some of the questions that, keep the conversation going, make sure everything is being looked at, nothing is being missed, and that you're in full understanding of why we're doing all of these things and why all these medications and what is the trajectory in general. So a bit of a summary here. We want to, of course, be engaged, stay informed, and understanding what your risk is. So living with lupus means that there's a 50% risk that the kidneys could get affected. So because of that, we know then it's very important for your doctors to be looking at that urine, at those blood tests every 3 months, roughly, so that we can screen for that. We don't want to wait for very bad signs and symptoms to come on. We want to pick it up as soon as it starts so that we can treat it promptly. We can start those medications and control the inflammation before there's damage and kidney failure and things that are needed, like dialysis or transplant. So continuing to engage, continuing to participate in programs like this, that's the way to go. So with that, I'll conclude, and I think we'll go to some questions. If anybody has some.
Thank you so much for that informative presentation. I know, even having had lupus for as long as I have had it, I've learned some new things today, and I'm so appreciative of what you brought to the table. And I know a lot of people watching right now are as well. So there was a question from Donna, who's joining us from Michigan. And she asked, well, she says that once I had been diagnosed with lupus nephritis, my nephrologist took over monitoring and medicating my blood pressure. Is that the norm?
So it depends really on the setting in which you're being cared for. Some lupus centers work very closely with a nephrologist. In other places, you see the nephrologist. So it depends on the setup, but it's appropriate for either the rheumatologist or the nephrologist to really take over that role. Anybody who is either the rheumatologist, the nephrologist who is seeing you, they're noticing your blood pressure is not controlled, that person needs to act on that immediately. So it just depends, but it's the setup that will determine that. However, the important thing is that somebody is treating it and promptly adjusting things.
Another question. Lupus nephritis can affect you emotionally, not just the stress of being diagnosed with it, but also the way that it can throw your electrolytes off balance. That's something that's not talked about very often. Can you talk a little bit about that?
Sure. So, depending not so much actually the electrolytes for the emotion for the cognitive or psych status, but actually when waste, right? We said the kidneys are eliminating waste. When waste in the body rises too much, then yes, we start seeing that our mentation gets altered. So that's a direct consequence of the kidneys not being able to clear waste. So that can absolutely happen. And usually when that occurs, that's an indication that dialysis is needed. Because then that has to be cleared out of your system. There cannot be a delay, but that happens too.
How well do patients work with coordinating with a team of doctors, and how much should we be responsible for communicating between our rheumatologist and nephrologist? And how much should the nephrologist and the rheumatologist be responsible for communicating quality of care?
Well, so, ideally, they should, of course, be communicating. And I would think that usually happens because, if you're seeing your rheumatologist first, then your rheumatologist will be the one driving the diagnostic process and treatment, because they have to contact the nephrologist to say, can you please biopsy this patient so that we can diagnose and so forth. I guess once you're already established with both providers, so the communication should really flow, because there's already that report or that initial phase that occurred. I know that sometimes the setups are not good, especially if it's in different institutions and some things can fall through. It's not ideal, but I think The electronic medical system, medical record system is improving some of that, because now there's something like called care everywhere. So I can easily read the notes from all the different hospitals in New York, for example. So that has facilitated things, but I know what you mean. I mean, the responsibility is on everybody. I mean, we want just the best outcomes. We want everybody to be on board and know everything that's going on, but it certainly becomes more difficult when it's different institutions. And yeah, I usually encourage my patients to try to keep everything in the same place to avoid some of that, but I know that's not always feasible. And yeah, we make the best when that's not the case.
I think that's it for the questions. A lot of comments saying Dr. explains everything very clearly. Thank you for the information. Awesome presentation. This is great information. I'm going to share this to all my pages. Sounds great. So a lot of positive feedback. So thank you.
It is really my pleasure. So thanks so much for having me here, and happy to help in any way I can. So everybody enjoy your weekend.
Thank you again.
Bye.
Goodbye. Now we have the pleasure of introducing a patient advocate extraordinaire. And he is also a nonprofit leader. Like I mentioned, he has multiple advocacy platforms, and he is a lupus nephritis patient. Please welcome Emmett Henderson III. Emmett.
Hello there, Kelly. Thank you. Thank you so much for having me.
Oh my goodness. I feel like even though we've worked with different projects together, this is the first time that we're kind of doing a one-on, not really one-on-one because there's other people here, but conversation where we really let people hear your story.
Absolutely, absolutely. So thank you for introducing me. My name is Emmett Henderson III. I was diagnosed with systemic lupus and lupus nephritis back in 1995. As the doctor explained, with everything that goes on with lupus, it wasn't an easy diagnosis for me. I had symptoms going back to 1980. And as a man, lupus is not the first thing that they would rule as being the problem. So 15 years later, back in 1995, I started experiencing major joint pains and swelling and fevers. I was going back and forth to the hospital. They could not figure out what it was. They ended up looking into the fevers. And when they decided that I had kidney involvement in there, they diagnosed me with the lupus, systemic lupus and lupus nephritis. From there, it really did a number on me. Statistics do say that men get it more severe than women. And I think I can vouch for that because I did get almost every organ affected in my body, from major heart failure to lungs to liver disease, brain disease. I went through it, Kelly. I really went through it. Not only that, but I developed a vascular necrosis, which caused it all in my joints, including my hips, shoulders, knees, which involved a knee replacement as well as a shoulder replacement. A vascular necrosis in the other joints as well. But at this point, I'm kind of knowing how to baby them and not get into the surgery right now. So when lupus, gave me the brain disease in 2019, it ended my career, as I was working the whole time, trying to stay as motivated as I can. But it gave me the brain disease, which the doctors would not sign me to go back to work. With that was my key to go ahead and talk and tell my story. All these years as a man with lupus, it wasn't easy to talk about having an illness that I was described as a woman's disease. With everything I was trying to maintain as my status, working, raising children, it just kind of didn't sound right coming out that I had a woman's disease. So I didn't much talk about it at all. But as I seen people with their diagnosis and what was going on with them, I decided to be a voice to where, let me talk about what I've been through, and hopefully that my story can help others. With everything that I've survived, I didn't know I had a story till I told my story. And when I did, it was something that I saw that the communities needed for men to speak up on the platforms that the women are already doing an awesome job of putting it out there. We just want to raise the bar and help be that voice that autoimmune diseases are real. And it's okay for us to not be okay at times that what we're going through. There's a lot of help that's out there, but we won't know it unless we open up and look for it and mention that what we're going through. I decided to create an organization in 2019, and I called it Male Lupus Warriors. The reason why I did that was I wanted people to know that this is a man's story with lupus. I wanted them to know that this is a man's story that went through all of this, and I am here today to tell my story, which hopefully to give hope to those that are going through this disease and this illness. I had a kidney transplant in 2013 with going through dialysis for about a year. And then once I got transplanted, my kidney did good for the past 10 years up to last August in 2022. I had my second kidney failure at that time, and I am currently now on hemodialysis, which I am doing that 5 days a week, 5 hours a day. I understand the process. I know what needs to be done, but now I'm not only shifting my advocacy towards lupus, but also the importance of donation, of organ donation as well. So I kind of went through it, Kelly, but right now it's, again, God's got me here to tell the story on this platform, and I thank you so much for having me.
Wow. You are such an inspiration to so many people, and
Thank you.
your resiliency is not only inspiring, but it's energizing.
Thank you.
I think that people are drawn to you because of that, well, because of a lot of different things. You are absolutely correct. Men living with lupus deserve a seat at the table, deserve to be heard, and this notion that lupus is a women's disease needs to be dispelled for once and for all, because it is not, and we know that that is the case.
Absolutely.
Surely there's a lot of stigmas attached to the disease. There's just, in general, so many misunderstandings about lupus, and men, boys, teenage boys bear the brunt of a lot of that misinformation.
Right.
So you talked a little bit about your journey. You shared, I know, just a glimpse, because you've been through so much this journey. And you talked about how you've had symptoms for decades.
Yes.
And then you gave us an update about how you're doing now. What's the next thing around the bend for you right now? I mean, obviously you have dialysis today.
Yes.
5 days a week. Can you talk a little bit about the process? I know I didn't run this by you before, so I hope you're okay with that. Can you talk a little bit about the process of dialysis and what it's like? And I know many people watching.
Absolutely. Absolutely. Well, dialysis basically is doing what the kidneys are supposed to do. They put a port, which is called a catheter port, that is connected to some main artery and veins in myself. And the machine, dialysis machine, is what basically flushes my blood. I'm not eliminating waste the way normal body would with kidneys. So the dialysis machine does it. It's basically keeping me alive because we need our kidneys to do so. So depending on, I guess, the severity of where you're at and what stage level you are at kidney failure is how the doctors give you a prescription on your dialysis. And doing it 5 days a week tells you that mine is pretty severe. So I do maintain that. It's pretty much an easy process, should I say, once the doctors gets you through it. Once you do it as a mainly routine, keep in mind, this is my second go around. So it wasn't something that was not familiar to me. I kind of knew the steps of what I wanted to do when it came to this, but I would not have known any of this if I didn't educate myself on the process. And that is one of the biggest things that you could do for yourself, knowing that the ultimate outcome is that you're going to need dialysis to continue on. So educating myself made things easier. And to this day, I have a really good team that supports me on that.
Thank you. Obviously we're not trying to scare anybody by talking about this, but there is a vigilance that you need to have when you have arthritis, to be on alert for the signs and symptoms that may bubble to the surface at any point, and be proactive with taking care of your kidneys, because like you said, they eliminate wastes, they control balance of hormones as well. They are also what helps with electrolyte balance in the body too, and you don't want to mess with that.
Right.
So you started to say it a little bit, but so what would be your biggest advice for someone newly diagnosed with lupus nephritis?
Absolutely educate yourself. Once you educate yourself on not just what lupus is, but how lupus nephritis affects the body and the kidneys as well, there's a lot information that's out there. There's organizations that's out there that literally supports just that aspect of lupus and the kidneys, because of, just like you said, Kelly, how vital that all these kidneys play in our bodies and everything that it pretty much is connected to and controls. When you educate yourself on it, a lot of it is going to come from you being the self-advocate for yourself and not just depending on what the doctor's word is. This also includes the procedures, it includes the medications, this includes self-care, this includes proactively getting yourself into a state to where you know that the kidneys are damaged, but you're not going to make them any worse. So you're going to, take these by the horn and just live your life the way you're meant to. Education is the biggest thing I can stress.
And how can people get involved with learning more about lupus nephritis and becoming a patient advocate like you've done such a shining example of?
The best thing that I have learned how to do that, Kelly, is to talk to other like-minded people that is in the same situation. It's like me having lupus as a male. No, there wasn't too many, when I was in 1995 being diagnosed it. So it was kind of hard to get that. Now that time has gone by, I find it very interesting to find other males with it. And I learn from them. Despite my 28 years with this illness, I can learn from somebody just diagnosed a year ago, and so forth and so on. It's also just making sure that, get involved with support groups as well. You want to hear stories from actual people that are going through it, as opposed to what you read and from what the doctors tell you. To me, it's more comforting to know that you've gone through it and I'm hearing you.
Well said. I'm nodding because 30 years ago, there was no internet, really.
No.
There was no patient platforms.
No.
There was not places for us 30 years ago. I didn't go to my first lupus support group until I was in my mid-20s.
Yes,
Almost
exactly.
almost 30. That was my first lupus support group. And I recall in the hospital being kind of, you clumped everybody together. I went to support groups with chronically ill kids who had cystic fibrosis and HIV and type 1 and all other illnesses. So take advantage of what we have now. Everyone is watching. You have information at your fingertips. You have that have done the work and are committed to continuing the work. And if you can find those trustworthy places where you can share your story and spaces where you feel comfortable to join, it's there. It's there. And we have Maria here who supports lupus nephritis patients so professionally and so many different levels. It's like, take advantage of it. We didn't have this. We did not have this 30 years ago, even 20 years ago.
Well, keep in mind, Kelly, when they told me I was diagnosed with lupus, they gave me a pamphlet with a woman's anatomy in it. It's like nothing was there towards men. So that was very discouraging. And now that I know that it's just a keyboard click and everything is there, yes, definitely educate and take advantage of it.
Yeah. And children as well. I mean, when I was diagnosed, children weren't diagnosed with lupus. They didn't want to say the words because that was a woman's disease of childbearing, late childbearing age.
Right.
That's what we were told.
That's exactly.
Yeah. Wow. Well, I just want to say thank you so much. I know you have a busy schedule today, and with dialysis and other events that you're committed to, I don't want to take up any more of your time. But where can people find you, Emmett? Where can people follow you and get connected to the work that you're doing?
Thank you for that. You guys can find me on almost all social media platforms under Male Lupus Warriors. On Facebook, it's under my name at Emmett Henderson because I was one person before I was a Male Lupus Warrior. So that's where you're going to find Emmett on Facebook, at Male Lupus Warriors, in TikTok and Instagram and Twitter and just about all of those. So I would be glad to talk to anybody. Thank you.
Look at you on TikTok. I haven't even done that yet. You teach me how to TikTok.
Oh, it's fun. It's just a fun, and I put out my message in a different way that people are buying. So I love it. I love it.
That's so great. Keeping up with the times. I love it. Well, I just
Yes.
say thank you again to panelist Emmett Henderson III, and of course to Iridium Pharmaceuticals, and to Dr. Geraldino-Pardilla for her wonderful presentation earlier. And as always, please visit morethanlupus.com for resources and support and more information about lupus nephritis. See you next time, all. And this will be available.
Thank you.
This will be available on YouTube and as well as on our other channels for those who don't have Facebook later too. Thank you. Have a great rest of your day.
Thank you, everybody.